Good morning, everybody. This is Dr. Baker. I'm here with Diane, and she's a great patient, and she got her stem cell injections a couple months ago. So Diane, we're going to start from the very top. So you got your neck injected, you got your hands injected, and you got your back injected, and then ultimately your feet. So let's start with the top, Diane, and then tell them the story you told me about your eyes as well. So let's start with your neck. Since your stem cell injections, Diane, how is your neck doing? And tell us about your eyes.
Okay, I'll start telling you about my eyes. I had glaucoma, and I had damage from the glaucoma. Okay, I was supposed to have surgery, and 2 weeks after I had the stem cell therapy, I noticed there was a change in my left eye. My left eye had damage, so it's like part of my eye had a window shade over it that was black. So I couldn't see to the right with my left eye. Well, it went from black to gray to like you had sunglasses on. And now it's almost gone. My pressure was 28, went down to 22, and ended up being 12.
That's amazing.
And
weren't you able
I
to...
mean, I was going blind, and I was going to have the surgery. The doctor said, I cannot help you with the damage that's already done. It's done. You know, you can't make it come back. We can just keep it from getting worse. And it disappeared.
So it totally disappeared.
Yes.
So you can actually see normally in your eye. And didn't you pass your driver's test as well?
Yeah, I could write my driver's test. I don't have to wear glasses. It's just amazing about my eye.
Awesome.
And this was a side effects that I didn't expect. When this happened, I told my husband, I think it's not true. And I went to the doctor, and he says, well, yeah, it's true. And then I went back, and 3 months later, and it improved so much.
That's awesome, Diane. Great. So tell me about your other areas you got injected. You got your hands injected, and your back, and then you also got your feet injected.
Okay, and my neck. My pain used to be so bad in my neck when I would wake up that I couldn't raise my head. I used to take a Tylenol pill, but I'm saying it was so bad I couldn't open my mouth or put my head back. You know, when you drink something, you put your head back. So I'd have to use a straw, and then I'd have to put some heat on it. And it was terrible. I have not had that problem at all. I do have issues with it when the weather's bad, but nothing like that. And then I got bad headaches, severe headaches with it. I haven't had headaches. So that's about the neck.
That's wonderful.
Right. And also, I used to have trouble turning. I can turn, but not completely. You know what I'm saying?
Yes.
It's improved a lot.
And how about your hands?
My hands used to be so bad that it was hard for me to use a phone. The bad finger is on my right hand, which I use, and the index finger, which you use, Well, it was so painful, I couldn't even do it. And that has, I don't have that problem.
Excellent. And then ultimately, how about your feet? And I noticed today that when I first met you, you were on a walker, a cane, and today you didn't have a cane.
Yeah,
and when I first saw you, I could tell your demeanor was way better.
I've improved greatly with my walking. Also, I want to say what this has given to me is the spirit of youth. I feel the quality of life is so much greater. I went with my husband to music hall to a symphony, which I was going to probably have to go in a wheelchair. All right, we parked the car, we walked, and it was far. We went through the whole thing, and I would never be able to do it. Then after we went there, we went out to eat. then when we came home, I told him I feel so great. And that would never happen, you know. I wanted to see the music hall because my grandfather painted the ceiling.
Wow. That's neat.
And after they redid it, I wanted to see it so bad, but I knew I wasn't going to be able to. So that was a real plus.
That's awesome. And aren't you planning a vacation now to Mexico with Vern here?
Yeah, then we're going, which I didn't think I would be able to do again, is to go on a cruise or go someplace, because I have issues, you know, with going to the airports. All this you put your body through. So I think I'm going to be going on a cruise for our 15th wedding anniversary.
Congratulations, that's great. And would you recommend this procedure to your friends, family members?
Oh, definitely.
Great.
Yeah, it's amazing. It's not just one thing. It doesn't just affect your hand or your back. It's your whole being.
Exactly. Awesome.
I can't. I feel so much more vital, so much more youthful. Something I could not do, too, is I have not been able to cook a meal from scratch. I take frozen foods and put them together, use canned foods. Well, I've been using my crock pot, and I've been cooking from the beginning.
Wonderful.
And I couldn't do that.
So Vern is the recipient of some really good home-cooked meals from scratch.
Right?
That's excellent. Vern, how do you feel about that?
It's a remarkable improvement. It's like a miracle.
Excellent. Okay, Diane, so I'm going to see you back for your next follow-up, and thank you so much for sharing your great story. See you next time.
Okay.